Why do lupus blood tests sometimes give false results? Lupus is a tricky disease to diagnose because it can look different from person to person. It's a complex autoimmune condition where the immune system attacks the body's own tissues. Because of this, no single blood test can definitively say if someone has lupus. Instead, doctors relying on a combination of symptoms, physical exams, and multiple lab tests to piece together the puzzle. Symptoms of lupus can come and go, making diagnosis even more challenging. Common signs include fatigue, joint pain, skin rashes, especially the butterfly-shaped rash across the cheeks, and mouth sores. Some people also experience fever, hair loss, and blood cell abnormalities like low red or white blood cells or platelets. These symptoms can fluctuate, with periods of flare-ups and remission, which can confuse even experienced doctors. To diagnose lupus, healthcare providers look for at least four of the established criteria. These include specific types of rashes, joint issues, mouth ulcers, and blood abnormalities. They also consider other signs like kidney or lung problems. Because these symptoms overlap with other diseases, doctors must carefully rule out conditions like rheumatoid arthritis or infections. Blood tests are a key part of the process but are not conclusive on their own. The most common test is the anti-nuclear antibody test, or ANA. Many people with lupus test positive for ANA, but it's important to know that a positive result can also occur in healthy people or those with other conditions. So, a positive ANA alone doesn't confirm lupus. More specific antibody tests are then used to support the diagnosis. These include anti-double-stranded DNA, anti-Smith, anti-Rho SSA, anti-La SSB, and antiphospholipid antibodies. These tests help confirm lupus after an initial positive ANA. Blood counts are also checked to see if there's anemia or low white blood cells, which are common in lupus. Inflammation markers like the erythrocyte sedimentation rate can indicate ongoing inflammation but are not specific to lupus. Urinalysis and organ function tests help determine if the kidneys or liver are involved, which is common in some lupus cases. Sometimes, doctors perform biopsies of skin or kidney tissue to see if there's organ damage. These procedures can provide direct evidence of lupus-related tissue changes. But overall, diagnosing lupus is a careful process that requires expert evaluation, usually by a rheumatologist who considers all these factors together. It's also important to understand that blood tests like ANA are not perfect. Many healthy people can have a positive ANA, and false negatives can occur if the disease is in early stages or if tests are done improperly. That's why diagnosis involves more than just lab results. It's about listening to the patient, examining symptoms, and ruling out other conditions. Because lupus can be misunderstood and difficult to identify, staying in close contact with healthcare providers is essential. They can interpret test results in context and help develop the best plan for management. Remember, every person's experience is unique, and accurate diagnosis takes time and careful assessment. If you're concerned about lupus, always seek advice from a qualified medical professional who can guide you through the diagnostic journey with the most current and reliable information.